I've been on nortriptyline for almost 20 years. When I started my journey with nortriptyline, I actually started on amitriptyline, which is the sister product. When I was pregnant with my first son, I started suffering with the horrendous bouts of vertigo. But not only did I get vertigo, I got where if I went in supermarkets and there were lights and then I was tracking the shelves, I used to either faint or feel like I was going to pass out or feel like I was having a seizure. I used to feel so unwell, and then I'd be stuck in bed for days with dizziness. Nobody really knew what to do with me or what was wrong with me. I was really lucky in that I was treated like I wasn't crazy, because they did actually find something, and they told me when they did this test that my inner ear nerve was sending incorrect signals, and therefore I needed to have that cut. I would be in ICU for a couple of weeks. I'd be really, really dizzy with the room spinning, and then my brain would compensate, but I would lose my hearing. And something inside of me was like, that doesn't sound right. I don't know why. I just kind of had this feeling. Luckily, a family friend who was a physiotherapist dealing with dizzy patients said, when we've got dizzy patients that don't get better, we send them to this chap in London who's amazing. So I got sent to Dr. Surintharan, and he absolutely saved my life. Started me on a diet for migraine. He diagnosed me with vestibular migraine. And at that point in 2007, nobody really understood that migraine could present itself as just dizziness without the headaches. And actually, I was treated quite poorly by some doctors and the Migraine Society at that point, because they didn't believe that that was a migraine. They saw migraine as headaches. I was getting light sensitivity, visual symptoms, and severe dizziness to the point where I was stuck in bed every single day, couldn't watch the TV.